Hi everybody, there is 3 patients.
All Taylor Green today. It's a Taylor Green exclusive. It is today.
All me today.
Oh,
How lucky.
Sit back and relax. Kick back a little bit. I am enjoying it. I rest my weary head against the wall into this now.
So you can see we've got this first patient here. A little bit of a mix, mostly wax here at the moment. Patient has been using oil. You can see how sort of wet it is around this plug. But it's not going to come away in one go, unfortunately. We're just going to break little bits away. Slight bend to the ear canal at the entrance there. I mean, there's nothing too difficult, but you normally tend to find that the wax gets trapped in those little areas.
Yeah.
You can see it's literally just like an onion. It's just coming away in layers. This one.
It's been very well behaved. It's all pulling forwards for you at the moment, isn't it? Have I jinxed you in other words? The next piece going to be really deep down there. No, we're okay.
Nice and easy. I'll switch to the fine end here now just to get this last little bit away. So yeah, it's coming away in decent sized pieces, to be fair. Because the patient obviously has used quite a lot of oil as well, you will see a lot of this like kind of staining around the ear canal, which is quite wet. But again, I know we've always said that, we're not overly concerned about these little bits because they will eventually just make their way out with showers, baths, if you go swimming. But we're just trying to get away the worst part is a little tiny bit there. You've got to go really, really close to the ear canal, and again, you can see some of it's actually resting up against the eardrum. And what I thought was going to happen, it was all going to start peeling like a big flap of skin, but it's literally just coming away in little tiny spots.
So you've got to kind of hover.
So I'm just trying to get this last bit of here we are. That's what I was kind of expecting was going to happen.
Yeah.
They do tend to whistle a lot, these little bits though.
Yeah, even with a fine end, sometimes you'll get a little bit of clarinet in, won't you?
Yeah. So I'm trying to drop over the top here now just to get that a little bit. I was hoping it was going to lift in that slight recess there in front of the eardrum. We've managed to get a little bit of it away.
Yeah,
I'm not going to...
There's no point. For the benefit the patient would get compared to holding the suction tube down there for any length of time, there's no point.
No. It's the same patient, obviously the other ear, but it's harder on this side. The wax, patient has been using oil both sides, but it obviously hasn't quite... Oh, what's the word? Yeah, I couldn't think of the word then. I know what I'm saying, but I can't think of the word.
See, there's a reason I'm still here. I just supply the odd word every once in a while.
Cheers, thank you very much.
No problem.
So I'm just trying to wiggle this out of that gap there. Now, this is what I mentioned about on the other side, where it comes so far and then it just kind of gets trapped. So I've rolled it slightly, got a better grip here now, and it was a relatively big piece,
plug.
that one.
Yeah, good size plug.
Got a little bit of mess to tidy up there now.
I think your next one's soft plugs. I think the last one I got a little bit jealous because I thought, he's gonna have there's a bit of skin in the last one. I thought, we might be on for a ribbon. Yeah.
We haven't had them for a long time.
I haven't had a decent skin ribbon for ages.
Do you know what? I think Christmas 2023 might have been my last decent
I haven't had one for
ribbon.
I used to love a skin ribbon. Yeah. I think Claire had one recently, but we didn't measure it up though, so we couldn't put it on. Inch and a half.
So three and a bit centimeters. 3.5. Yeah, 3 and a bit.
So make sure you stay tuned for Taylor's next one. This is a soft plug coming up next. Then we got skin and wax for the last one as well. Oh, that is really soft. That's an aggressive wax softener being used there, or a lot of oil, one of the two.
So I think this is more sodium bicarbonate.
Oh, okay.
I think it was sodium bicarbonate the patient's been using.
Bleaches it, doesn't it?
And it almost kind of goes that whitish sort of colour, doesn't it? It's like very, very light yellow. But you can see as soon as I got the suction tube onto it, it was all like just collapsing into the tube. And it's still coming. We've got this big layer here now. I got a little spot on the camera, sorry. It's a little bit blue. Oh, you can see I just shoot up the suction tube.
A good piece of skin there, isn't it?
I don't actually think there's a ruler shot on this one because I think most
it doesn't surprise me, because everything's gone up the tube so far, hasn't it?
So far, if this comes out in one piece, we might be lucky.
What's your bets, everybody? Quickly chuck it in the comments. Is it going to come out one piece? I'm dubious. I got to be honest.
I actually can't remember.
Oh,
I can't
maybe.
remember. So I think we swapped the tube to the standard size, I think, for this bit now, yeah. Or was I already on the standard size? I can't actually.
I think you were on a fine end.
I was a fine end.
Yeah, I think so. Oh, I don't know, Taylor. I didn't think that was going to come away as one, but I think it... I got
Get the grip, get the grip. Oh.
Excuse me. I usually have about 7 in a row, so you're quite lucky now, is it? Wow.
I know my dad's one of those.
Oh, I'm terrible.
Just one sneeze, it's about 8.
Yeah, it's like me, that is.
Oh, a little bit of oil on the camera again. That's a problem with those little hairs when you use a bit of oil.
Yeah.
It just, you just can't help it. You've got to touch the front of the camera and then it's misty.
Yeah.
Oh, here we go. Just trying to hold the grip there.
I can't tell whether that whole thing is moving or whether it's just that bottom section that's come away.
Oh, it's taken away some of that softness, but quite a big piece there. Oh, look at that.
There we go.
It's come away cleaner than what I was expecting.
Yeah.
There's a couple of little bits around the edges here. Again, blockage has been cleared.
Yeah.
We're just going to try and get some of these little pieces of dry skin away. And we're just going to recommend the patient stop the sodium bicarbonate and switch to an olive oil if they want to use it regularly. We only generally tend to recommend sodium bicarbonate if, we have to book the patient back in for a follow-up or, if they're actually just coming in for irrigation. We do get some patients that, request a certain type of wax removal.
Yeah.
But yeah, a lot of the time it's just olive oil that we would, recommend.
How thick that skin is. You can see how pale that skin's gone as well.
Yeah. Oh, zero trying to suction into, collapse again into that tube.
Gosh.
Yeah, all these little soft bits on the outer edge. This is what we normally expect the sodium bicarbonate to do.
Yeah.
Because if we get somebody coming in with a really solid, and I mean rock hard piece of wax that we can't take away.
That chap from the video on the other day.
Yeah. Then that's when we would usually suggest the sodium bicarbonate to kind of get it to this level.
Yeah.
And again, if it should come away nicely with microsuction, but if it's very, very wet, if the whole thing is just covered in just wet wax, we'll just give it a little rinse. A couple of seconds and it's done usually. Yeah,
a bit of irrigation, wash out it'll all be. This is what some people, patients ask, do you do a lot of irrigation now, or is it done? We don't do it. I wouldn't say we do loads of it, but I always say that we take every wax as a case by case basis. Sometimes you'll think, right, that's going to come away so much, and sometimes I'll do both. Yeah. If we get a patient that's had a solid plug and they get wet wax behind it, we'll use the wet irrigation to get the wet wax off.
Yeah. Yeah, it's a bit of a messy one. This is. It's not. It has come away okay, to be fair, and luckily there was nothing pressed right up against the eardrum, because that would have been...
We're certainly looking a lot better than it did, isn't it?
Yeah. So we've just got this little bit now that's just on the roof of the ear canal. Again, it's really, really stuck to the ear canal, this. Yeah.
Oh, there was a ruler shot, there you go.
Oh, there was, yeah, there you go.
So just under, or just over 3/4 of an inch.
2 centimetres there. So again, like I said, we're going to suggest the patient just, give her a little rinse in the shower or use a little bit of olive oil. That, eventually should start to migrate. Yeah. But we'll probably see the patient again in about 6 months, 6 to 12 months for another appointment.
So we've got some mini ribbons in this one.
Oh, yeah. We're still waiting for one that is like 7 centimetres long.
Oh, I know, I do miss those days. Yeah, the really big old skin. That's probably one of the first ones I think I ever put on YouTube. I think it was certainly in the first.
Was it like 11 centimetres?
11 centimetres, yeah. Still my all-time record, that is. Lots of people in the comments want to know if we've ever come across living things, bugs, stuff like that. No, we'd love to, but we've never come across one.
Yeah.
No.
No, we don't really tend to get it in this country, do we? It's not warm enough. It's not hot enough.
I did see a gent. If you're ever interested in there's actually a British audiologist called Nick Chitty. So if it's NickChitty, have a look at him. I know that he took a spider. I think I've got a funny feeling that it was out of a relative's ear as well. This is going back in the day. This is when I first started YouTube. I remember watching that video. So he's actually one of the first YouTubers to voice over, and show what he was actually doing. So if you ever get a chance, go and have a little look at his channel. He's based down in Devon. Lovely place to be.
Yeah.
That'd be nice.
Perfect, that is.
Yeah.
A walk on the beach on your lunch break.
Yeah, it'd be lovely. I'm sure he does hang gliding as well. I think I got that stuck in my mind from somewhere. This is a blast from the past now. I haven't watched this channel for a little while, but yeah, there's definitely one on there.
So we've cleared the one side, just starting the other side. Patient's not feeling blocked up on this one because you can see the eardrum in the distance. So the patient is still hearing okay, but again, just feeling a bit of itching, bit of dryness to the ear. Sometimes, we get patients with like flaky skin coming out of their ear, which is normally normal with this type of like drier wax.
Yeah.
But again, patient has used a bit of oil, to be fair.
I see these ones I love. If you can just get a hook and just pull and the
whole
thing comes out. It's like a forbidden donut.
Yeah. You got it. But this one is a little bit too stuck to the ear canal, I think, for that to happen. We're having to peel quite a lot of dry skin away here. So we're just getting to this main plug now. So that was the softer, thinner sort of skin on the outside, and it is attached, look to that.
This is what I thought was going to be a ribbon. I really thought this was going to turn into a skin ribbon.
You did start to pull it, didn't you? I'm pretty sure at one point you can see it, just underneath you can see it drawing out. Yeah.
I really thought, oh no, he's got a skin ribbon, look at that.
Yeah, it was pretty, tiny one.
It's a shame because it's sheared there. I think that's what it carried on into this next section.
If it was softer, I think it probably would have. If there was a bit more oil, I think it probably would have, to be fair.
That would have been immense, because look at that. If that had come away as well as that first section, look at all this coming away now. Look at that. Imagine that. I think that probably was a ribbon. I think we took the front section of that one as well.
Gutted.
I know. I would love that one.
Just trying to get these last little bits all stuck around the corner now, these little bits.
Always the most awkward bit to get into, isn't it? That sort of bottom right corner.
Especially when it's still attached with that dry skin as well.
Yeah.
Oh, gosh.
Yeah.
Probably could have put a little bit more oil in at this point just to try and... I mean, it is coming away okay, but usually would have come away a little bit easier.
You can see it's still, I think imagine if all of that had come away as one, because I think that probably would have done if it just at the right circumstances. Nice. Oh, that was a good piece.
Yeah, there we are.
Oh, you did right, did the other day? Just kind of hover over it and everything gets sucked in like that.
It's them little tiny bits.
Wax some oil in, I do at that point. Just
I know. I don't think I do, but I probably could have, to be fair. I think that's why I stopped getting that one, because it whistled. I know we don't put the sound on the videos, but it's a horrible noise. I actually had a patient say to me yesterday, he's like, can you hear that as well? I was like, yeah, of course I can. Yeah. It's loud. Yeah. It's loud for you, it's loud for me as well.
It's coming away nicely, there we go.
Got to be careful here, because that little bend there now is where we're just getting to that sort of bony portion in the ear canal.
It's nearly there.
Yeah, just got to try and shear it now. I don't want it to start peeling all the way down the ear canal. Yeah, you can see it just starting to tear away there. There's a little bit of wax behind it. There we go.
Oh, that came away well.
Yeah, lovely.
I didn't think that was going to come away well.
You can usually tell by looking at the videos like what time of day it is when you're doing these, because earlier in the morning it's nice and still. Towards the end of the day you start being like, start getting a bit fatigued. Oh, it's all peeling down the ear canal. Look, that's what I didn't want it to do. There we go. Last little bit at the top there now.
Almost there.
Always really tricky, these ones. I mean, it's you can be in here for for a lot longer trying to get every little bit from this ear canal, but it is clear. The patient's hearing better. Look at that.
Fair play. 2 inches.
Bit of a mixture of colours there as well.
It is, yeah. We got a wax gradient going on. It's like a Dulux colour chart.
Yeah. Got 5 centimetres there. So that, pretty good one.
Well, guys, thank you very much for watching the video again today. If you do enjoy the videos, don't forget you can always why can't I say this? Like, heart, share, follow and subscribe for me. And definitely. And as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another, and myself and the lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye-bye.